Hello. So you want to lose some weight. I'm sure you've done all the conventional things. Dieting. How many diets have you tried? Have you tried intermittent fasting, ketogenic diet, South Beach diet, Atkins diet? You can keep it up for a while and you can probably lose a few kgs here and there, but you find it extremely difficult to maintain. Have you tried exercise? The problem with exercise is that it takes a lot of exercise to burn calories. For instance, if you jog whole 30 minutes, you only burn 300 or 400 calories. And if you just eat a hamburger, you put on more calories back than what you've burned. So it's also very, very difficult. So you have to do diet and exercise together. Doing it together, you can probably lose 10% of your excess weight within 6 months to a year. But the bad news is that within 2 or 3 years, you'll probably put it all back. That is because your body has a set point. And your body defends the set point. So if you go above the set point, your body tries to make you lose weight to get back to the set point. And if you lose some weight, then the body tries to make you eat more and get back to the set point. So you always end up where you first started, at the set point. So you have to do something to actually reset the set point. And there are only a few things that you can do. You can of course try pills. And there are many different types of pills, but most of them cannot be taken long term and they all have terrible side effects. One type of pill will decrease your appetite and increase your satiety, but it causes your blood pressure to rise, it causes palpitations, it may cause insomnia and cause you to be nervous. Another type of pill will reduce the absorption of fat in your intestines. So you'll pass out about 30% of the fat. But that may mean that you leak all into your trousers and you may stain the seats that you sit on. So that's also very, very convenient. What it does make you do is to avoid eating a fatty meal, which is of some benefit, and you can lose maybe 10 kilos or so if you persist for 3 months. But as I said before, once you stop, you tend to put it back. So we have to go for more serious and more technical options to help you lose weight. And one of them is an injection. You can inject into a stomach a substance that will slow down the stomach, keep food longer in it, and also block the nerves that make you hungry. This injection has an effect that lasts about 3 to 4 months. And then you can probably repeat this again. The good thing about this injection is that it doesn't have any side effects, and it is quite effective. You can lose 5 to 10 kgs. But after that, it's again up to you to maintain. But this injection is repeatable, so if you can't maintain, you can always have another injection. Another way is to put a balloon into the stomach. Balloons can be put in for 6 months, and some balloons can be put in for a whole year. The 6-month balloon can lose you 10 to 12 kg, and the 1-year balloon may be 20 or 25 kilograms. Well, the problem of the balloon is it does have some adaptation period, which is quite uncomfortable. You might have some nausea, vomiting, cramps. And also, when you remove the balloon, you tend to put back the weight that you lost with the balloon. But again, the balloon is repeatable. So you can do it multiple times, and you can put a new balloon in after 3 months after removing the last one. And you can continue going like this until you've lost all the weight that you want to lose. The best way to lose weight, of course, is some kind of bariatric surgery. And the two most common procedures are a sleeve or a bypass. The great thing about surgery is that probably there's less side effects than a balloon, and it is permanent. You don't have to repeat it again, and most often times you will lose about 30, 40, 50% of your excess body weight and be able to maintain it. Of course, in some cases there's a relapse because people are drinking their calories or their stomachs expand after the operation and the weight does come back and may require a second surgery. But it is probably the most reliable way to lose large amounts of weight, especially if you are super obese or morbidly obese. So please think of all these options when you want to lose weight, because diet and exercise alone under your own steam and unsupervised is really something that probably will not succeed in the long run. Well, if you are interested in health topics and improving your lifestyle and your well-being, then you should look for subsequent articles and videos in Future Medicine. Please tune in on us so that you may learn what is the latest in the health scene. Thank you.